It's a Northwest News Radio weekend. Now, back to IRG's Health Talk.
All right, our next guest is Dr. Arinola Dada, a rheumatologist at Overlake Arthritis and Osteoporosis Center. Gout. I know a few people who have it, Shannon, and she's going to be talking about that.
Gout is painful. Dr. Dada, we're having her back. She is so energetic and has such passion for what she does. I'm excited to talk to her about gout. Man, if you've ever had gout or know someone has, it is painful. We're going to find out what it is, how to treat it, and why is it so painful.
All right, Dr. Dada and Shannon O'Kelly.
Dr. Dada, welcome back to Health Talk. How are you?
I'm great. Thank you for having me back.
Absolutely. Last time you came on, we talked about kind of your area of practice, your interest. We know you're a rheumatologist and you work at Overlake in the Bellevue area. But maybe for our listeners that maybe just need to catch up a little bit, can you give us a brief history and kind of background and kind of what you do on a day-to-day basis, maybe?
Okay, great. Thank you. Yes, so I am a rheumatologist, so I have been practicing in the greater Seattle area. We have a clinic in Bellevue, Overlake Arthritis, and I've been doing that for the last 20 years, gosh. So I manage the practice, and I'm the mom of two amazing, beautiful girls. I teach, I mentor, and I speak. So in my rheumatology practice, I help people with gout pain as well as autoimmune disease become pain-free and get their immune system back on track. Well, I was just kind of going to explain a little bit that a rheumatologist is a doctor that treats autoimmune diseases, and people are used to hearing things like lupus, rheumatoid arthritis, psoriatic arthritis, osteoporosis. Those are the kind of conditions that we treat in our clinic.
Yeah, I want to talk to you real quick about something because I seem to be seeing it a lot in the media and in the medical community. You talk about autoimmune diseases. I mean, maybe you can tell us what that means, because I have noticed a lot of autoimmune issues and diseases, particularly in the younger population. Is there something going on there? What's going on with autoimmune diseases? I know that's a big topic. Maybe you can share some light on that.
You're really right. I don't know that we have a clear understanding as to why there is an increase in incidence. Question is there also an improvement in the way we can detect it? But let's go back to what is an autoimmune disease, right? An autoimmune disease is one in which the immune system is attacking itself. And my favorite analogy is to kind of compare the body to a country. And the immune system is supposed to be your military. And their job is to protect you from foreign invaders, such as, for us, viruses, bacteria, and parasites, or domestic invaders, things like cancers. And when something has gone terribly wrong, then the immune system or the military just turns its weapons against itself. So kind of like anarchy. Right. But you're right. There is an increase in incidence of autoimmune diseases. Some of theories are, maybe just more toxins in our environment, just more water pollution, the fish get polluted, oil spills. I don't think that we have a clear understanding why, but definitely you are totally right. There is an increase in the incidence of autoimmune diseases.
Does there seem to be a certain gender? Is it more male or female, or a certain age range where these things kind of show themselves, these autoimmune diseases?
So children can get autoimmune diseases too, so they're pediatric rheumatologists. But you're right, as we get older, I think women are more likely to develop autoimmune diseases than men. Some of it has to do with fluctuation in estrogen during the premenopausal years. But yes, you're right. Definitely more common in women, and then more common, I think, for women specifically during those years where they're fertile, which is the years before menopause. But yes, there are also, interestingly, autoimmune diseases in children. But for children, interestingly, a lot of their autoimmune diseases tend to burn out, quote unquote, tend to become less severe over time, so that they don't necessarily manifest it. So as long as they can prevent organ damage and joint damage as children, usually a lot of those autoimmune diseases don't necessarily persist into adulthood. It's not 100%, but a lot of those don't necessarily persist.
Wow, I sure appreciate your explanation regarding the immune system. We're going to take a little break here, and we're going to come back and talk about gout. So we're going to dive into gout. So we're just going to take a little break here, but we'll be right back.
Okay, sounds great.
Back with more with Dr. Dada and Shannon O'Kelly after this on Northwest News Radio.
It's a Northwest News Radio weekend. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
And our conversation with Dr. Arinola Dada and Shannon O'Kelly continues.
Dr. Dada, again, thank you for joining us. Health Talk, wonderful job of explaining your immune system and kind of what rheumatologists do. I have a ton of respect for you folks. You're like this detective, kind of finding out what the body is doing. And these rheumatology diseases and autoimmune diseases are very devastating sometimes, but in the good hands of a good rheumatologist, I mean, they can be taken care of and people can be functional. But let's talk about kind of our topic today is gout. Tell us about gout.
So gout is a condition where the body really can't clear the uric acid as quickly as it should. When your body is metabolizing, so whether it's turning over within itself or the kind of foods that we eat, or if we're overweight and we're not able to get rid of the uric acid appropriately, then the uric acid likes to kind of crystallize into joints. It can crystallize into joints, tendons, and different organs. But the most common is when people, think about gout, they think about the first toe. And so crystals typically accumulate in the first toe. And, to be clear, right, I think, unfortunately, I found out that there's actually a lot of shame about gout. People feel, well, you know what, if you ate better and you took care of yourself and you went overweight, then you wouldn't have gout. And that is so unfair, right? A lot of the reasons why people have gout is actually because genetically their kidneys can't get rid of it fast enough. And when the uric acid crystals move around the joints, then people get this acute, horrendous, feel like somebody smashed my toe with a hammer pain.
Oh, it's very painful. I've had patients that have had gout and it's extremely painful. What can I do, or what can a patient do that maybe can help prevent this, or how can you treat it? I mean, if I have it, what do I do?
There are two things, right? So one is if you've had it and you want to prevent a future attack, so then things like, making sure you're hydrated. Cherries have been shown they have antioxidant properties, and they actually lower the uric acid level, and they increase the ability to get rid of it. If one is overweight, really getting one's weight under control and minimizing alcohol intake and avoiding, we're in Seattle, avoiding shellfish, but avoiding those things that are really packed in proteins and trying to get protein from a little more plant-based. And that helps more in prevention. If you have an attack, there's already a fire, right? Now you have to put out the fire. Obviously, one thing will be talk to your doctor, because there's really no reason for you to go through that pain. You can be taken care of. So one is your doctor will probably say, hey, take an anti-inflammatory medication, which may be prescription strength, like ibuprofen type of thing. There are also steroids that can be given. Again, it has to be given in kind of, under the care of a doctor. Medication called colchicine. So, so there are things that can be done to kind of get rid of that pain. There are also shots of steroids that can be done and can also kind of help at, get rid of that painful attack.
Yeah, Dr. Dada, I'm out of time. We're out of time. Thank you for the information. I'm going to ask you, let's have you back on. I want to dig into these autoimmune issues because so many young people, I know so many young people that are experiencing this. Will you come back on with us?
Oh, I'll be back. Yeah, you can't stop me. I'll be back.
Thank you.
Okay, thank you so much. You take good care.
We've been talking about gout. Dr. Arinola Dada, you can get more information, overlakehospital.org, and causes of gout and the recovery is the most important thing for those who suffer from it, Shannon, and good to get some advice from her.
Absolutely. Gout is painful. I personally never want to get it.
Yeah, my son-in-law has dealt with it, and he's an avid runner, and he was reduced to not even being able to get into bed without having to alter the way he did so. He had to kind of do a modified Fosbury flop.
Yeah.
Back with our final segment after this time out on Northwest News Radio.